doulas help in reducing labor time by 41%.
Hello, everyone. I'm Dr. Brittany Fatoma, but I love to be called Dr. Britt, and I'm very excited of being here today.
Yeah, and I'm so proud of you. Congratulations on earning your degree. Love to see you.
Yes.
Hi guys, it's your girl Lydium PC here, back again with another educational, motivational, and inspiring video. If you're new to this channel, please feel welcome. I am so glad to have you, and I hope you'll find my content encouraging as much as it is inspiring to me and to my subscribers. And to you, my subscribers, thank you so much. I appreciate you guys, for everyone who has been, sharing my videos, encouraging people to come check out my channel and subscribe. I'm so thankful to you, and especially to the ones who have been messaging me, asking me, hey Lydia, we need more videos. I know it's been a while and I apologize for that. So from April 11th to 17th, it's Black Maternal Health Awareness. Yeah, and in honor of that, we want to create awareness and also call people to action to help in supporting like health and well-being of Black mothers and also birthing people, correct? Yeah, so in honor of that, we're going to be talking about doulas. So I know some of you are like, what is that? What does that mean? So Dr. Britt, who is a doula?
So a doula, I like to compare a doula to a birthing coach, a birthing support person that is there not only to support the birthing individual, but also their family through the entire birthing experience. So that's prenatal, that's labor and delivery, that's postpartum, and it can truly range on what the birthing individual needs. But a doula is there to support, to provide comfort measures and techniques and strategies, to be a liaison between the healthcare professional team and the birthing individual. And then my favorite part is being a support for the birthing individual to advocate for themselves. One other thing I wanted to add to my doula definition: doulas are trained. So someone doesn't just wake up and say, hey, I'm going to be a doula. Now, I'm not saying that people can't be supportive, but doulas are trained in supporting families and what that looks like operating within the healthcare system. So I didn't want to throw that extra little.
So you have to be certified. And
yes, certified and fully trained. We definitely are very appreciative. I'm definitely appreciative for my training through Uzazi Village.
Did you say Uzazi?
Yes, Uzazi Village.
Yeah, so I had to pause a little bit there because Uzazi is actually a Swahili word.
Yes, it is. Yes,
okay, so being Kenyan and a Swahili.
Yes. Correct me all definitely. Let's go. I appreciate that. But yes, thank you. So we were trained through them, and we had to take 4 sections, 16 hours per section on what it means to be a doula, reproductive health. We also looked at breastfeeding. So, it was very extensive. And the person that starts off the training was a nurse educator.
Okay.
Spent, I know, like 20 plus years in labor and delivery. And so we had a very robust foundation in just anatomy. And I'm not sure that all doula programs have that. And so we're very much aware of what's actually going on with the woman's body, even though we're not healthcare providers. We're very much aware of what's happening with the body and the anatomy of the body as it relates not only to the woman or the birthing person, but also how babies get here in the first place.
Okay. So that's good. And let me just emphasize, you say you're not like healthcare providers. Just to make that clear.
Yes.
You are trained to support the person going through the birthing experience, right?
Yes. Let me be very clear. We do not catch babies. I have a joke about the midwife when one of my clients gave birth. They weren't moving fast enough, and baby was out. And I was like, hey, don't do that to me again. We do not catch babies. We are there to support the healthcare professionals, healthcare clinicians.
Okay, I see. Having the option to have someone to come there and support you, it's wonderful. So let's say I discover today that I'm pregnant. So is it time for me to contact a doula, or when should a pregnant woman contact a doula?
You can absolutely contact your doula at that time. And I've even had a client, or as we always say, our mommies, contact us, and I think they end up having their baby like 2 weeks from there. So it could be a wide range. Ideally, having 2 weeks is not ideal because you want to be able to have time to build relationships, but also earlier in the pregnancy means we just have more time to get to know each other, support you in creating a birthing plan.
What's your role? What's the role of the midwife and the OBGYN during the birthing process?
Awesome. So my experience here in Columbia and the hospital that I've got to be a part of deliveries the most is at NU Women's Hospital. And so typically in the room it can be pretty full. Okay. But at the basis you'll have, depending on who the birthing individual selected for their clinician, you can have an OBGYN or a midwife.
Oh, okay.
Mm-hmm.
Okay.
So the midwives, because they're overseen by an OBGYN, they don't necessarily have to be in the room when the person delivers. Okay. So, but if a person chooses to have an OBGYN, then it'll usually be, of course, there'll be OBGYN in there. And typically, because NU is a teaching hospital, you usually have a resident, the attending, maybe even some med students in there. Yes. But we're going to definitely support that, so they're learning. Yeah. And so where the doula plays in, which is another one of my favorite things about being a doula, we can play every position but actually delivering the baby. Mm-hmm. So in a birthing space, it can look like the birthing person in any position they want, depending on what interventions or things that they had to do within their birthing experience. Their partner or support person there. Me, I could be with them, helping them as they're pushing or working through their comfort strategies. I could be the person holding the camera, getting that birth video footage. Yeah. I can be with the nurse helping move and adjust them. I can be guarding the door because sometimes after people have birth, they're not like quite ready for folks to come in. So like, hey, like we just want to give the family some time in this first hour, like call the golden hour. So educating, so the doula can be in all positions. I've also, when a baby has to go down to NICU, and the birthing person wants me to go with the baby and like their partner stay or their support person stay. So I've also gone with the NICU team down to, Yes, it is. The doula can definitely play pretty much every position except we do not deliver babies.
You do not deliver babies. You left that for the doctors or the midwives.
Yes, correct? That is correct. Okay. But we can support all the way through, but the hands that are delivering baby, especially within a hospital, is going to be an OBGYN or a midwife.
Okay, and then after the delivery process, you're still there with the client?
Yes, we're up to an hour or 2 hours, and usually we're just there to help with that first latch. That baby have that first latch, give that a nice good colostrum, right? Yeah. So usually we're there to help and support with that first latch and just make sure that that they're doing well, family's doing well, getting that time to just kind of figure things out, and then we kind of slowly move away. Always ask like, okay, you still need us? Don't feel bad about kicking us out.
Okay.
But we try to make sure we're there for that first meeting.
Okay, and so that's not it, right? You're still supporting the birthing mothers even after that.
Yes,
so that day you leave after 2 hours, but then, so when's the next time you get to see your clients? So
depending on how they birth, if it was a vaginal birth, it could be like 2 to 3 days after. If it's a birth by C-section, we'll usually come and see them the next day just to make sure they're okay, because things are a little bit different when you have a C-section, and the healing process is a little bit different than a vaginal delivery. And so just so they're supported, have a good idea of exactly what's going on. Because that's another thing as a doula we take much pride in, is making sure that clients are able to make informed decisions. And so they have all the information, they feel supported, asking questions, and make sure they really understand what the clinician is communicating, so that they're still very much aware of what's going on. And sometimes that can be difficult after having surgery.
I see. Okay, yeah, because they're still down. Yeah.
Yes.
Okay. Because I want healthcare providers to watch and benefit from this video as well. So I'm imagining if I'm an OBGYN, how do I feel supported by a doula, and ensuring that a doula does not pass conflicting messages to the client as me, you know.
Absolutely. So ideally, the first time we meet is not in the birthing space.
Okay.
And so we let clients know, like, it's your responsibility to communicate with your healthcare clinician who will be in the space with you. And then if it's okay, we'd like to join at least on one of the visits so that we can be introduced. We're all on the same page. And so ideally that happens. Sometimes it doesn't.
Sometimes it doesn't.
Right. And so if we like that 2-weeker, and so it was, I think initially, if I'll be honest, the midwife was like, okay, yeah, why are you here? And so my job in that moment was to make sure that I build rapport and a relationship quickly as possible, because it only hurts the person that's birthing when we're not on the same team. And so it's like, hi, no, I'm Dr. Brett. I'm so glad to be here to support. And, you know, just I'm here to help. So that's how I come off initially. And then as they're talking and speaking, that's why it's so key that doulas were always aware of not talking for clients, but empowering them to talk for themselves. So as the clinician is explaining things like, okay, this is how things are going to go, we're not necessarily asking questions. We turn to the person like, do you fully understand what's going on? Do you have any other questions? And so then they said, well, I'm not sure. And I was like, well, you know, we did talk about this. Are you still very clear about, let's say, one of the questions was, the labor isn't progressing. Is there anything that you can do to help move your labor along? And the person's like, yeah, is there anything I can do to move? So you kind of feed and empower them to talk to the clinician. I think that right there removes that conflict. And then really just be helping them. So if they're doing something, may I help you? Oh, let me get that door for you. Oh, let me get, so just being willing to help, play whatever position. And I think keeping the lines of communication open and understanding those boundaries and allowing the client to lead, I think alleviates a lot of that.
Okay, that makes sense. Just like any other profession there, like maintaining an open communication is very important. So that sounds like doulas are very helpful. I'm just imagining myself as a mom there, confused, scared. So I think it's very nice to have a doula around. And guys, I just wanted to read out loud here a few statistics that I learned about doulas, and I was impressed. And that's why I was like, I wanted Dr. Britt to come and tell us more about it. So according to research, doulas help increase the chance of going into spontaneous labor by 15%. So that means they reduce the chance of needing like an emergency C-section by 15%. And again, they help decrease the need for a C-section by almost 50%. So I was like, wow, that's impressive. So if a mother wants to go through like the natural delivery process and they don't want a C-section, that's great. Like doulas can help reduce the chances of requiring a C-section, And then lastly, they help reduce the time of labor by 41 minutes. I'm like, that would be nice.
Yes, especially as a first timer, because you know those bad boys can go for days. And may I add to that? So when we are educating and supporting the family that a baby is coming, I think that also helps, because when you're going to the birthing space, you want as much information as possible. But we also know things can change dramatically depending on how baby's tolerating labor, especially when interventions are used. And so I know there's myths out there about doulas only supporting home births. No, I mean, unless a doula specifically says they only do home births. I know us in our practice, we support home births, we support hospital births. We don't actually have a birthing center here, but if we did, we would support that too. So knowing that, having that conversation of where you plan on giving birth so that the doula knows, and then the importance of us knowing is it kind of can shift what options and things that you have. So of course, if you're having a hospital birth, that's going to look a little bit different than having a home birth or at a birthing center.
So wow. So I guess someone would wonder, okay, so if doulas have all these benefits, so in your words, what would you say doulas do the most that contributes to the statistics that I just read?
I think just having another person in the room that isn't necessarily related to the person, but also not the clinician team. Having that person that's truly neutral, right? I think helps. We're in there continuously. We know within a hospital, depending on what time of day and what's happening, the clinical staff can't be in there all the time. But the doula is. The doula is literally there, especially once the person goes into active labor into up to 2 hours. And sometimes that can be 24 hours, 6 hours, 3 hours, 2 hours. It just all depends. And so knowing there's that person that's constantly there, making sure like the person feels supported, and labor, we want it to continue to progress and move, and that person being in a very comfortable and relaxed space is ideal. And so having that doula there to constantly be able to support, I think, definitely adds to that.
That makes sense scientifically, actually. Because I'm just thinking, if you feel connected to the doula and you have the oxytocin being released, and
that's what we want.
Helps you. Now it makes sense. Because I was like, how do doulas help in reducing labor time by 41%? But I guess the release of the oxytocin explains that. Yes.
The labor and delivery nurses, they're awesome. They're coming in but they're not able to be there all the time. And so with us being in there, and it's kind of funny, I'm usually like, hey, it's time to change positions. And then they're coming in, they're like, you ready to change positions? And so like having that person already there helping to change, because changing positions frequently during labor delivery also moves the labor along. Well, so I also think that cuts into the time as well.
Okay, so when it's time to change a position, do you go ahead and help them change, or you contact the nurse too?
It all depends. So if it's something that I think requires the moving of any kind of medical equipment, we're definitely contacting the nurse. Because again, we're not clinicians. Yes, to be clear. But if there's none of the medical equipment needs to be moved, then we usually don't call the nurses unless we absolutely need them. And so that's another benefit too. The nurses, they don't have to do as much work because we're there with the client and helping them change positions. We usually just call them when they're absolutely needed, which I think also helps too. Because they're helping and working with other patients. Well, they may not have a doula.
Yeah, that's true. That's true, actually. Yeah, that's very helpful. So you only work with one birthing mother at a time, right? You don't have, how many, let's say in 1 month, how many patients can you have?
So we usually put the cutoff like at 2 because we have a strict policy, and I'm with the Mid-Missouri Black Doula Collective. And so we usually do a week before the due date and up to 2 weeks after. So give or take, we can be 3 weeks within the due date. And so you don't want to be running from one room to the other. And that kind of totally defeats the purpose of being with that person. However, if we do have 2 births in the same month, and they do happen to go into labor, because it happens, babies coming in, we do have backup doulas. So that's the beauty of being a part of a collective. And we also have those conversations with our clients as well. What will happen if we do need to bring in a backup doula? They know them, they know their birth plan. There's been some time to build a rapport. But typically 2 births a month is enough. I don't know how people do any more than that, to be honest.
So that's during the delivery, and before, you say you meet with them before. Do you teach women how to push, how to deliver pretty much, or do you leave that to the healthcare professional?
Now, I'm sure doulas do. I do not. I think what we really more focus on is the comfort measures and techniques and positioning, like how you want to push, but we don't necessarily, me personally, I don't necessarily practice pushing.
You know, okay.
Yeah, but we do talk about like positions that you have available to push, and that's of course depending on what medication, what type of interventions. And so we'll have those conversations. To me, learning something completely new that you've never done in the birthing space can be very overwhelming for someone in labor. And so I'd rather us practice it and not need it than need it and not practice it.
Yeah, that makes sense.
And I think that's also like a really great question for the person to ask. Like, okay, when it comes to pushing, is there a particular technique? And then we can kind of practice and work on it. We tell them what they should be feeling and when they know like it's time to push. But not necessarily, because I know some can do a count.
So after delivery, and you say you get in touch a week later, maybe after delivery. So how do you support pregnant and
Yes.
birthing mothers after that?
Yes, great question. So again, depending on if they had a C-section or a vaginal delivery, depends on how many days we check up with them. But then the rest of their visits, it is really mother-led or birthing person-led. Like for their other postpartum visits, they can stretch them out or put them together or even add more. But our basic, and I say basic things that we're trying to make sure that we address is infant care, also their body, what's going on as they're healing and recovering from giving birth, breastfeeding, or just even how they're choosing. Now we use chest feeding. How are you feeding baby? How are you taking care of baby? How are you taking care of you? Because we also try to encourage people to give their bodies time to heal in between deliveries.
Yeah.
Not everybody listens, and we support whatever people decide about how quickly they want to get pregnant in, but we do try to encourage them within that 2-year period, and so making sure they actually have some type of plan to not get pregnant before within that time.
Clearly, doulas are beneficial. We have statistics to prove that. So if a birthing mom, a pregnant woman wants to use your services,
yes,
how do they get in touch, and how much money should they plan to spend, and how can they pay? Do you have monthly payments? Does insurance cover? So things like that.
Yes. So particularly if birthing individuals in the Columbia, Missouri, and surrounding areas want to reach out to us, we have a website, midmo, blackdoulacollective.com, Facebook, Instagram. So you can definitely contact us. We have our number and our email on our website and on our socials. And then once you contact, we'll say congratulations.
Yeah.
We're always excited and celebrating another person coming into this world.
Yeah.
And then we'll let you know, like, we have a list of doulas, and so on our website you get to kind of read about each and every one of our doulas and see which one best fits you, and then we set up an initial conversation, kind of a getting to know, and we go through all of our paperwork. So yes, we have paperwork.
Everywhere.
Yes,
you cannot run away from
No, you can't. And again, informed decisions. So we want you to know exactly what you're getting, exactly the price. Currently, we charge $1,200 for the birth. Well, not for the birth, for the entire package. So that includes 3 prenatal visits, which are between an hour and a half to 2 hours long. Sometimes they run a little bit longer, it depends. And each one of those are valued at $100. So there's 3 of those. And then the labor and delivery, we typically, we check in whenever you feel like you've gone into labor. But once you go into active labor, we're with you up into 2 hours after. And so that's valued at $600. And we say, that could be 2 hours to 2 days, it ranges. And then we do 3 postpartum visits, just like the prenatal visits, each valued about $100. And they can be an hour and a half to 2 hours per visit.
Okay. But just generally, you say per package, someone can just pay $1,200 and they will know they will get all the services.
Yes, but maybe you feel like, I want to kind of customize and make some adjustments. We can. All the money is not due up front. Typically, you'll pay, if you were paying out of pocket, you would pay for each one of the prenatal visits as you do them. And the same thing with postpartum. We do ask that by the time you're 36 weeks that you pay for the labor and delivery, because we know just things by 36. Ideally, we want you by 30, at least by 37, but we know sometimes things can get interesting by 36. It's just usually ask for that, but you can kind of, again, payment plans, we're flexible. We don't allow money to be a barrier. So some people that do self-pay, we also are working now within our state, and I believe we are just about there. Not all insurance companies are on board, but we do have a very great relationship with Healthy Blue, and so those that have Healthy Blue, they're able to get reimbursement. We're able to get reimbursement through that insurance company, but it's not across the board yet. We're getting there.
So Medicaid does not cover that.
Unless you have Healthy Blue through that.
Oh yeah, Healthy Blue. Okay.
Yes, and then yes, you're covered.
Okay.
And sometimes it's just a matter of you switching over to Healthy Blue if you have another one with Medicaid. And we've helped and worked with clients if they are on Medicaid, they can switch to Healthy Blue, so that Healthy Blue is able to cover those.
So do you help clients with that, with switching, or it's something they have to do on their own?
They have to do it on their own, but when I say we'll help, like we'll tell them who to call.
Okay.
It's usually you just call the number and then let them know. It's a very easy process.
Yeah.
But sometimes you just need that little extra support. So
Yeah,
we're
yeah,
there to sit there, support you with or be on the phone, like however you need,
Yeah.
and kind of walk you through the process if necessary.
Yeah, no, that's great. That's great. So just to take you back to that training a little bit, because I know some people have questions. So you say you have 4 sections of 16 hours, 4 sections of 16 hours, so
Yes.
a total of 64 hours.
Yes.
So I know you're a doctor, you're a PhD holder. So,
But that's an education, not medicine.
in education, yes. But then I was just curious because I feel like someone will have that question. So who qualifies to be trained as a doula? Is it just anyone interested in?
Oh, that wants to be a doula?
Yeah.
Yes,
Okay.
absolutely,
Okay.
absolutely.
You don't have to be a doctor or a PhD holder.
No.
Okay.
Anyone that wants to train me
Mhm.
can definitely be trained.
Okay.
And then I forgot this part. We do, within our certification, we're also certified community health workers on top of that. We have to maintain our certification. I joked that I just got an email yesterday about making sure that I'm doing my continual education
Yeah.
to maintain my doula certification. So I know not all doula training programs and certifications work like that, but just ours is pretty rigid. But we prefer it because that makes sure that we're on top of our practice as doulas.
Yeah, of course. Okay, that's great. So, and I know you're certified here in Missouri,
Yes.
but if I happen to give birth in Arkansas, would you come and help me?
Yes,
Okay.
yes. As of right now, to my current knowledge,
Yeah.
that's not necessarily how doula practice works.
Okay.
But if there is something out there that is, please correct me.
Okay.
I don't feel like I'm the know all be all of all information.
Okay.
But even though I'm certified here, I can definitely come and support. My first birthday actually was in Florida.
Okay. So I guess I was thinking in terms of insurance.
Mhm.
So if someone is not self-paying, they're using Medicaid.
Mhm. Right.
Healthy Blue Card, the payment.
Now, that's a really good question.
Yeah.
I do not know.
Okay.
I don't know the answer
Yeah.
for that.
Okay.
But I think we would definitely have that conversation because we don't want that person to be
Yeah.
expecting something and not get it.
Yeah, for sure. So from your perspective, what would you like the members of the public to know about doulas? Or because we are creating awareness and calling people to action in honor of Black Maternal Health Awareness Week. So we are doing this video again to create awareness and
Yes.
to call everyone to action. So what message do you have to the general public?
So I would first say that all states need to get on board, right, about supporting doulas being reimbursed. Because for some time, people were just doing this out the kindness of their hearts. But we know we live in a capitalistic society, so people have to eat. They have to, be able to provide for their families. And so making it accessible to everyone by providing a means for insurance companies to reimburse. And you might say, well, why insurance companies? Because in essence, they're the ones that are getting one of the greatest benefits besides the birthing person because of the cost. The cost could be significantly different depending on like the birthing situation. And so we're saving them a lot of money. So why not? Like what they're investing, trust me, what they are investing and paying us, they are getting back in the billions.
I agree. Given the numbers, again, reducing labor time by 41 minutes, reducing the chance of a C-section by 50%, and reducing the need for an emergency C-section by 15%. That's a lot of money.
Yes, it's a lot of money and time. And money and time, we know money can't be time. So just contacting your local state reps, senators, like this is an important issue, and to follow suit. Missouri is one of few states that is moving in that direction, so it would be nice if we have more states moving in that direction. I would also say, if because the reason why this is so near and dear to our hearts, although we serve all women or all birthing individuals, we really want to bring awareness to Black maternal health. Black women are up to 4 times more likely to die in this country from birth-related things. And so just being aware of that and making sure if you know someone that identifies as Black, and as a birthing individual, make sure they have all the support and help that they need. And so, you know, nothing better than a doula for a gift, right? I know we like to get diapers and wipes and things.
Oh,
you can give someone a doula, right?
Oh, you guys have like a gift card someone can
yes,
purchase?
absolutely, absolutely. We've had funding was donated to us. Now we are a for-profit, but funding that we were able to help moms in need, birthing individuals in need that could not afford it. So we don't want money to be a barrier. So that's definitely a way that you can support. Maybe you can't do the whole $1,200, but like, no, prenatal visit, that's on me. Postpartum visit, that's on me. So finding ways to definitely support and just getting the awareness out there. We do not want to continue to see Black women and Black children dying.
Last week I attended a talk by Brittany about doulas and Black maternal health, and you mentioned something about actually people dying, and we cannot just sit and relax and wait for people to die. And an interesting fact that you shared was even the richest Black women out there, for instance Beyonce, like they have twice as much chance of passing away during a delivery or a birthing process compared to other ethnicities, right? So it's a big deal. So, and I like the fact that you say people can step up, and instead of gifting, you know, diapers and having a registry, you can just say, I'm going to pay for your birthing experience or your postpartum doula. I think that's great. I think that's amazing. We are inventing, you know, the space where we celebrate birthing moms. So I think this is great.
I think I really just want to push the importance of having a doula present, but even if, let's say, for whatever reason you can't have a doula, we also talk to family members on how you can show up as a doula-like presence and what it just looks like in supporting and advocating for families in that birthing experience. Yes, so I want to talk about family and friends, and when the birthing person is saying something doesn't feel right, I don't know if I'm listen to them. They are an expert of their body. They may not have the clinical terms, or they may not have the doula terms, but if something doesn't feel right, support them and encourage them, even if you have to take them to the emergency room to be seen. It's better to be seen and there's nothing wrong, therefore there's something to be wrong and you're never seen. And so that's why I wanted to, the third part was family and friends. You have an active role in supporting the birthing individuals in your life. That if there's something that they say doesn't feel right, they're not comfortable, or just it may not make sense to you, and that's okay. Get them checked out, because we don't want it to become a life or death situation. And I say this especially for Black women, when we say something is uncomfortable, it's usually in case it's pretty dire. And so it's important, if there's something going on, to make sure that you support them and taking them to get seen as soon as possible.
Oh man, I think I'm gonna have that on replay. That's very important. If something does not feel right, it does not feel right. Go check it out.
Yes.
Yeah.
Yes.
And I think as you talked, I was just thinking, so that's the message to the public. And for me, I have message to the healthcare professionals, which I think you mentioned in your presentation last week too. So when a patient comes to you and they say something is not right, take it seriously. Something is not right. Even if you feel like you're doing an unnecessary workup, just do it, right?
Yes.
Because we don't want to lose children.
Yes.
You know?
Yes. Locally for us at Kansas City, Chief's former cheerleader not only experienced infant loss, her baby died, but she died as well. And it was heartbreaking, because that happens a lot. But it's not talked about nearly enough. I'm not sure of all the circumstances, but I think it goes to say that if there's something wrong, listen to the person. Err on the side of doing too much than doing too little, because when someone dies, especially a birthing individual, and on top of that their child, we all feel the impact. You know, and death can be so far-fetched until it's closer to you. So even if you haven't experienced death closer to you, just take this seriously. And of course, for me, I'm talking to my healthcare providers, because one of the gastroenterologists last week gave us a lecture, and one thing that he emphasized, it was like, if a pregnant woman comes to you, a physician,
and they're like, I have abdominal pain, don't just say it's because they're pregnant. So say pregnancy does not give you abdominal pain. So if a woman comes and they say they have abdominal pain or any other complaint, like you say, check them out to prevent the death in maternal health, especially in the Black population. I think it's important. So that's our call to action for you all for this Black Maternal Health Awareness Week. I got it.
Yes! Nailed it!
We did. Well, guys, what do you think about doulas? Did you know about them before you watched this video? And now that you know more about doulas, what's your take on it? Please comment down below and let me know what you think. Rick, is it okay to share your contact information on this video?
Yes.
So that you guys, if you have any information, I'm going to link her contact information to this video and down below in the description below. So if you have any questions, feel free to reach out to Bree. You can message me as well, and I'll reach out to Bree. Dr. Bree, excuse me.
Hey.
Not just Brittany. It's Dr. Brittany. Okay. So thank you so much for your time. Thank you for sharing all the information about doulas. Personally, I've learned a lot. You know, even as someone in the healthcare field, I didn't know much about doulas until your presentation listing and our conversation today. So thanks for enlightening us. And yeah, in this channel, we educate each other, we motivate each other, and we inspire each other. So today I feel like I've learned a lot. I'm motivated and inspired. So thank you so much.
Yes, thank you so much for having me. This was great. I always love to talk about this.
So thank you. Hopefully we'll get to see you on our channel.
Yes.
All right, guys. Thank you.